Welcome to our clinic in Tijuana, Mexico. I'm here with
Khushbakht Hayat.
Now, what part of the world did you come from?
UK, London.
Okay, now, any comments? That's our home country, two great countries separated by a common language. Okay, what? Okay, you came out here with some joint issues.
Yes. It was osteoarthritis. Earlier, I was diagnosed with rheumatoid arthritis, which was wrong. And I was wrongly prescribed and wrongly diagnosed. So I've been suffering for 20 years now.
And that's a medical care, misdiagnosing, treating with. Do they treat with herbs and natural substances and diet? And
Nothing.
They treat
Just
with
medicines.
Just medications that suppress your immune system. Yeah. Oh, okay, crazy. Okay, now you know your knees didn't have full range of motion.
Yes.
Okay, where you were walking pretty bent over. Now you've been here for a couple of days.
Yeah.
What have you noticed? This is so cool.
This is tremendous, actually. I did not. I knew that I'm gonna be better, but that quick, that wasn't I was expecting. So I think in 1 day's adjustment, I felt really, really good, and I'm hoping that the further I'm going, I'm gonna be good.
One of our patients who saw her for the first time yesterday, he remarked, "Oh my gosh." Because you literally went from this to this. It was like,
I know, he was jumping, and I was jumping too.
Next week, you're going to be a lot taller than me.
Yes. I think in a few days.
Oh, for sure. Now, but you tried a whole bunch of things. Misdiagnosis. Even with a proper diagnosis, you're not going to see rheumatoid arthritis as a disease attacking yourself. You still have to fix the physical, chemical, emotional. Now, we were doing certain things, adjusting the spine, working the tissue, creating inflammation.
Yes, that's damaging tissue by correcting it. Wow.
Isn't that interesting? Because inflammation's not damaging the tissue, but
yes,
every doctor says it is.
Yes, it is.
That's why they prescribe the anti-inflammatories.
Tell me about it.
So what could you tell? Because you did something that most people don't do. You're in the system, you're getting the care, everything else, and you just said, no, let me try something else.
Yeah, actually that became because I was only 23 when I was wrongly diagnosed as rheumatoid arthritis, and the doctor said you have to live on the medicine for your life. I was not ready to hear that. I was a young girl, active and healthy all my life, so there was nothing like that. And when they suggested, I was devastated. And then, but since I was in so much pain, so I took the advice, but I started researching it because before that I did not know what rheumatoid arthritis is. So I started doing my research, and then I found out that how this drug works. So it says rheumatoid arthritis creates antibodies in the body, and it attacks immune system. And the drug, what does the drug do? It attacks the immune system, so it gets weakened, and so you don't get symptoms. And I'm like, hang on a minute, the immune system is already under attack. So why this drug is not working on the antibodies and the immune system?
Okay, we used to call this common sense because it's no longer common anymore.
Exactly.
What did your doctor say when you were mentioning?
Oh, he was deeply, deeply offended. I took the prescription, and he said, "This is what you prescribe. What are your comments?" And this is the only prescription. This is the only way of treating it. And I said, "I'm not okay with. Find something on your own." That's what he said. He said, "Find something on your own." I'm like, "Okay, I will." I'm like, "All right, I will." And then 7 years ago, my surgeon said, "Oh, you're not rheumatic anymore. You're osteoarthritis patient. And your knee is completely damaged. It's not working anymore. So we need to replace it with the plastic one." And I'm like, "This one is not working. How come plastic one is going to work? And for how long?" And then I said, "No, I'm not okay. I'm not losing whatever God has given me. I'm not changing it. I'm not replacing it with metal or plastic or whatever." Aside does. Please don't talk to me.
The strength of character to go against the doctor's recommendations. And I'm telling you, the knee wouldn't bend to 90 degrees yesterday.
Yes, now it is.
Yesterday, now it is. So, I mean, it's just human beings are built by God. They're smart. They're self-healing, self-regulating. Have you always had the strength of character to go against?
Yes.
Okay, yeah, that makes sense. Okay, what could you tell someone that's stuck in that medical paradigm? They're drug symptom.
Do your own research, listen to your gut, listen to your heart, and go to the right doctor's place. Don't just go to the white coats.
That's true. I mean, if your main source of medical care is somebody giving you a chemical, you can call it a medication, that alters your physiologic response to stress, you can call it blood pressure, cholesterol, or blood sugar, or type 2 diabetes.
Oh, yeah, I was diagnosed with diabetes too.
Oh, my little, she doesn't have that anymore. Isn't that weird? 95% of all diabetics are type 2. And type 2, if you look at the movie, it's simply raw. Within a week, everyone's off of the meds. Yeah, but it's a stress response. So healthcare should be taking care of your health, knowing that your body is self-healing and self-regulating. Like this girl. God bless you.
And God bless you too.
Just the courage that you had to take charge of your health, plus your results.
And standing up straight. I must say, this man is a savior. I'm saying it.
I'm just a wrench, and God does the healing. Okay, God bless you all. Stay healthy, my friends, and know that there is a solution for you. Just find it. If you can't make it here, find it to some doctor that can guarantee some results. God bless you.
Thank you.
Yeah.